You're good. Okay. Call to order. I'd like to call the September 2025 Clark County Board of Health meeting to order. Shannon, can you please call the roll?
Dr. Moore,
Present.
Dr. Robinette,
Here.
Dr. DeGuzman, Ms. DeWitt,
Here.
Mr. Adamson, Mr. Griffith.
Here.
Okay, additions to the adoption of the agenda. Are there any additions or modifications to the agenda that has gone out? Okay, hearing none, could I have a motion to adopt the agenda as presented?
So moved.
Second.
It's been moved in second. Is there any additional discussion? Hearing none, all those in favor sign by saying aye.
Aye.
All opposed, same sign. Motion carried. Okay. Moving on to approval of the last meeting minutes on August 22nd, 2025. You have received those. Are there any additions or modification to the regular meeting minutes from August? Okay, hearing none, could I have a motion to adopt the minutes as presented?
So moved.
Second.
Okay, it's been moved in second. Is there any additional conversation or discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All opposed, same sign. Okay. We're open for public comments. We are at the public comment section of the meeting. The time is for anyone from the public to give a 3-minute comment. If you'd like to present at this time.
Sure.
And this is Miss Diana Daniels.
Excuse my drunken sailor walk every time I sit down.
Okay.
The scar's looking really good, I'll just tell you.
Oh, sure is.
I'm here as a representative of the most underserved population here in Springfield, that is our homeless. And my question for you is directed towards the medical bus that was here beginning in September of last year. I would like to know who was responsible for scheduling that bus at its location throughout Springfield.
Would you like me to respond?
Yes, please.
So the health department staff were responsible for selecting the locations that we were serving.
Okay. How many times did it show up at the corner of South Fountain and Pleasant Street at the warming center?
I'm gonna look towards you, Shane. Do you know? I don't know all the
Sorry, I don't know
locations.
that, but no, not, I did volunteer at the warming station, but the bus was not there.
Okay, so can I ask why?
Yeah, I guess, I feel like it was more, so what we were doing specifically on that bus was flu vaccines.
Mhm.
And so there, especially in the beginning, we were trying to hit like what I guess historically has been like our high population demand for flu vaccines. So our first stop was at the United Senior Center. And that is where actually we got the most, I think, people in to get the flu shots.
Mhm.
And then it was just kind of looking around and trying to find different places that would let us come. That's also a kicker, is letting us come in there to do it.
Okay, so let me just explain where the disconnect is. So
Sure.
that bus also showed up at St. Vincent de Paul.
It did, yes.
And also showed up at the Catholic Social Services of Southwest Ohio at their offices. But the most underserved population that needed those flu shots and needed some health screenings were the 175 homeless that were served at the warming center from November through February.
Mhm.
And I think that was a great disservice, not only to our homeless, and when they needed the most, they can't get health access. And that was a perfect opportunity to actually get some people the help that they needed. The flu ran rampant in the month of January.
Mhm.
Darren was sick for 3 weeks. I was sick. We all were sick. So I don't know what the situation is going to be. I'm admonishing all of you. I seriously am. That you missed an opportunity to connect with our homeless and help them to achieve a better level of health when in fact they can't get it at all. Zero, nada. So this is an admonishment and an opportunity to think a little more critically of what the actual needs are for our citizens, and I'm talking about citizens in Springfield and not just people that are living here, citizens that have paid their taxes for years, have ended up homeless. They didn't get the services they need, and other people did.
I would say, I think that some of that was a little bit of lack of knowledge on our part, and that is something that we do need, or and I will try as well moving forward. But I know that I didn't even know that the warming station existed until it blew up on Facebook, which is actually when I reached out to Barron and I did start volunteering there.
Mhm.
But I didn't even know that it was a thing.
Mhm.
So I think a lot of that was just lack of knowledge.
Okay.
Had we known, in the beginning, maybe.
Okay, moving forward, let it be known that myself and Barron and a few others service the homeless community outside of the circle that we call regular servers, because regular servers are failing the homeless population by virtue of their non-understanding and their callous attitude toward the homeless. While it's overt, well, it's not overt, it is covert. And so my feeling is that you covertly said to the homeless population, somebody else is more important than you. You may not have thought you did that, but you did. And so that's where the level of animosity comes in. And I got the runaround from the city commission. Of course I did. I've gotten the runaround from county commission, so I was asked to bring it right to your plate. So if the bus is still here, get with Barron, get with myself. I can tell you where the pockets are, where the people, their teeth are falling out. They look terrible. They're in horrible physical condition, and they could really use a health screening, whether it's a flu shot or whatever else. I'm just putting that out for you tonight.
Yeah, so the bus is not here, but
Anymore.
if his information is the same as it is last year, I still have that.
Mhm.
And I will certainly reach out and see what we can do. Yeah, absolutely.
As it stands right now, I'll be perfectly honest, it doesn't look like we have a plan. We don't have a plan for the homeless. We don't. They're telling us like we do, we don't. So it looks like between myself and Barron and some others, we're gonna be stepping up again and asking the churches to house the homeless. So we will need some connection with you folks to get these folks the vaccines, the medicines that they need, because they're not gonna get it anywhere else.
Sure.
Okay, thank you. Thank you for your time. Appreciate it.
I think that was,
I have a question.
you don't have anything, right? Just to make sure, yeah, you're just listening.
Okay, I do have a question though.
Yes, ma'am.
So you said there's a warming center, on Fountain and Center?
There was. That was a center that was organized by Tennessee.
Nehemiah?
Hmm?
Is that the Nehemiah Foundation?
No, ma'am. That's
Okay.
the corner of South Fountain and Pleasant. It was there's two churches there, and the really big one on the east end, on the east side of that South Fountain Pleasant Street intersection was the warming center. We used the gym at that particular facility. Was able to get a certificate of occupancy, and Barron used his own money and donations to feed and house approximately 175 different souls throughout the winter, saving many lives. We'd lost 2 already last winter. And this winter is going to be probably the worst winter you've seen since 1978. So buckle up, Buttercup. It's not going to look good. And if we don't have a plan in place for our homeless, we're in deep trouble. If you think what we have going on now with black eye, where we have 5 or 6 deaths of homeless, not a good look. So thank you for your time.
Thank you.
Any other questions for y'all?
Well, are you guys going to be back at that location this year? And is it just when the temps get to a certain?
We don't want to be back there.
Sure, yeah.
Understand this.
Yeah.
We do not want to have to dig into our own pockets and ask for donations from citizens
Yeah.
in order to take care of the homeless.
Mhm.
That is a citywide responsibility. There isn't anything in place yet. We don't have any housing. These people are just wandering the streets right now.
Mhm.
Are they anxious? They're scared to death. Most of these people who have been homeless for years, and they know what the weather cycles are like. They know what this looks like, having a dry fall. They know what the winter's going to look like. And they're struggling now to find places. What basement am I going to live in when the cold hits? Because there is no plan in place. It should be already set that people know where to go. Barron and I have a plan. We've been contacting churches throughout the city, and we're going to be putting that out probably 1st of November if the city does not have a plan, asking the churches who have helped other people need to help our homeless. So that's going to be a challenge for the city. Okay, thank you.
Well, I want to volunteer as a liaison between Barron and Diana and the health board. Because I think our greatest public health issue, we want to always throw medicine at people, but it's sanitation and it's nutrition. And the fact of the matter is, these homeless people, they don't have a place to take a shower. They don't have a place to clean themselves. And if we're really concerned about public health, that is a public health issue, is worrying about the disease spread. A lot of it is based on poor sanitation. So I don't know if there's showers here or there's anything available, but that's something that we should be focused on. I feel like we're kind of focusing sometimes how many vaccinations we can get out, but we need to be worried about people who don't have basic sanitation and nutritional needs met. So I'll be the liaison between the groups.
You know how to get hold of me.
Mhm.
And Baron is
Yeah.
all over town. We're ministering tonight down in the park. So
Okay.
we talk to the homeless constantly.
Mhm.
And the fear level that these folks have right now is you come up and you can taste it. It's coming off of them and wait,
Mhm.
what am I gonna do?
Right.
Thank you.
Mhm.
And thank you.
Cheyenne, have you spoken to the majors at Salvation Army this year?
I've not been in contact with them.
New majors, Dave and Pam Rhodes, and I'm serve on that board, and I think that the ability to use it as a warming center, whatever barriers there were last year are probably removed this year. So I think that conversation can be opened up again.
She's spoken to you. I was gonna say.
So I'm going to just kind of elaborate a little bit because since you know, we're kind of a little mystified. The warming center, it wasn't just a warming center.
Mhm.
These gentlemen and ladies that we were able to help spent the night because there was no place for them to sleep. You lose 2 to hypothermia, it makes you go like this. And you have someone who comes in with 3rd-degree burns because they were living in Hunts along in Snyder Park. And you realize the depths of the situation these folks are in. And I understand that some of them want to be like that. I was homeless, I know I didn't want to be, but that's how I ended up. And through Baron's ministry, we've saved 53 people. 53 people came to Jesus. We had, I think, 40 that went into treatment that we're tracking right now. So it was an overnight stay for these folks, and that's what we need. It's a facility where if they want to roam the streets, okay, but at night, they've got to have a place to go. And we fed them 2 meals a day, with breakfast and dinner. But that health component was missing for them. And if we could have gotten some of these folks a little bit more health care, I know 3 that have passed in the last 6 months from, deeper rooted health problems that we probably could have helped. So I'm just putting it out there. And then this, Dr. Robinette knows exactly what I'm talking about.
Thank you.
Thank you. Any additional public comments? Okay. Thank you very much for your.
Thank you for listening. I appreciate your time.
Thanks, Diana.
We appreciate you bringing this to us.
Well, it takes a village, and priority-wise, we've somehow gone this,
Mhm.
and we need to get back on track.
Thank you.
Okay. Old business, proposed 2026 environmental health fees, second reading and public hearing. So today we have the second reading and public hearing for the proposed 2026 environmental health fees. The board members have the proposed fees in front of you for you to look at. These fees are viewable on the Public Health Department website also. The fees have been sent to the establishments as required by law. As part of this meeting, we will hold a public health hearing to receive any feedback on the proposed fees. Could I have a motion to open the meeting for public hearing on proposed 2026 environmental health fees?
So moved.
Second.
Okay, it's been moved in second. Is there any additional discussion? Hearing none, we are open for public hearing.
Need a vote.
Okay, I can find my place. All right, it's been moved and second. Is there any additional? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Same sign. Okay, the motion has been moved and carried. And a public hearing is now open. Zibby, have you received any written comments?
We have not received any comments.
Okay.
I have a quick comment. Is it this we're talking about?
Yes.
Okay.
Why is there such an increase on the individual public spa fees? It looks like other things are sorta.
Yep.
But there's a big increase there.
So, the way fees are determined is based on the amount of time inspectors spend in that program versus their total time spent
Mhm.
elsewhere.
Mhm.
Last year, it was switched. So previously, we would have one fee for a pool, a spa, and a special use pool. And we had to break it out based on the amount of time we were spending on each one of those. So we currently have, I believe, just one spa in Clark County. And there were lots of follow-up inspections that were done. We inspect pools and spas. We try every month to get out to all of them, that they're open. Not all of them are open all year, but that they're open. And so just based on the amount of time that was spent going back multiple times on that spa.
Is it, okay, so are we talking like the manicures, pedicures, massage?
No.
Like,
No,
okay.
hot tubs. Okay,
Oh, we have a public hot tub.
we do at
Oh.
hotels.
Oh,
So
okay,
it's,
okay.
public swimming pool is like your Y, Wittenberg,
Mhm.
the hotel pools, splash zone, those are public pools. If they have a hot tub, that's a spa. And then special use are like the splash pads, like
Oh,
at
okay.
Bethany's Spray Ground in Snyder Park. There's a splash pad at Splash Zone. They have the pool and then they have a splash pad. So that's the difference of what each one of those are.
And they were just non-compliant is why you had to keep going
Yes.
back? Okay.
Yeah, you see the data supported, that we could have charged
$900.
900, and we just, Zib and I sat down and go, we just can't. I mean, that's just beyond what we consider reasonable. So we tried to make it reasonable. But so, if we have the same experience this next year with multiple visits, we're going to subsidize it.
Mhm.
We'll see what happens. Next year, if we have the same thing, we might go, okay, it's got to go up a little more, but we're just trying to take it in steps. That middle column between the two yellow columns is the maximum we're allowed to charge based on our work.
Mhm.
And some of them, most of them were like, okay, yeah, we can't subsidize it. We have to cover the costs, but there's a few of them that were just like that one too significant. That would just be, go from $122 to $900. It just didn't seem palatable.
Are there any in-person comments? No? Okay, could I have a motion to close the public hearing on the proposed 2026 environmental health fees?
So moved.
Second.
Okay, it's been moved and second. Is there any additional discussion? Hearing none, all in favor signify of closing, signify by saying aye.
Aye.
All opposed, same sign. The motion has carried and the public hearing is now closed. Okay. New business.
Thank you.
We have a
Okay.
variance report.
Chris, can I have you pull up that, go to environmental? Okay, I'm gonna pull up there's drawings in your packet, but, I just created a folder called Board of Health, so go back one, yep. Up at the top,
Underscore,
yep, underscore Board of
this
Health
one?
documents. Yep, and then there's 12710 Ashbrook. Up one.
Oh, 2173.
Okay, so this is a little bit better picture of what the septic system's that's out there. So this is a sewage variance that
Hold on.
if approved, would allow a garage with a porch to be built within 5 feet of the outlet line of the septic system. as we've discussed multiple times, minimum horizontal isolation distance in Ohio Administrative Code 370129 says a septic system component and a structure have to be at least 10 feet away from each other. So pretty much that blue box that is drawn on there is kind of where they want to put their barn with a porch. So the concern is that they would be within 5 feet of that diagonal line right on the north side of the blue box. That's the outlet line from the tank out to their leach field. And their proposal will be 5 feet from that line. The concern is if they damage that line in any way, it's not getting to any of their leach lines. So it would start backing up there at the septic tank. But in this case, the property owner's requesting the approval of household sewage treatment system rule variance, allowing their garage with a porch to be built 5 feet from that outlet line with them signing a hold harmless agreement.
So it's the porch slab that's going to be within 5 feet?
Yes,
Okay. And the weight of the garage is going to be further away,
yes.
so potentially not harming their, potentially not.
So the risk issue is when they're pouring that slab, that they could potentially damage the system.
Outlet line.
But once it's completed, that risk, there's no other concern.
Yeah, I mean, with anything like this, it's also accessibility to the system in the future. Accessibility to the tank, they're maintaining the 10 feet, at least on the drawing, they're maintaining 10 feet to the tank. But if that line ever has to be serviced, I mean, the 10 feet's there for a reason. Zippy and I have talked, I think if you all approve this variance, we need to have a conversation with them and say, you've got to make sure your contractor's very careful not to roll over that line, because Zippy's right. You crush that line, damage that line, there's no treatment, there's no secondary treatment after that, so.
Do we go out and check it afterwards?
We have not gone out and checked after they install historically.
It's gonna be pretty evident if they messed it up, right?
The first time they flush, yeah.
So I think didn't we have one like this before where we approved variance, but during construction, we just need for somebody there to pay extra attention to make sure that they don't damage it, and if they do, we need to do some testing right away to make sure that it's okay.
Yeah, we can do a final site visit when they're done, say, hey, call us and we can make sure it's 5 feet. We have approved these type of variances before.
Well, I think if we approve it, to do a final inspection is a good option. Make sure it's 5 feet and make sure there's not any pop out coming up.
No other questions?
Okay, no other questions? Okay, let me find my place. Okay, could I have a motion to approve a household sewage treatment system variance at 2170 Ashbrook Drive in Springfield, Ohio? I'm not reading that parcel number. Allowing a garage with an open porch to be installed in a location that is 5 feet from the household sewage treatment system according to the applicant's variance request, with the responsible party holding a hold harmless agreement. And we want to put in there that we will have a final inspection of the 5 foot variance. Could I have a motion? A second?
So moved.
Second.
Okay, it's been moved and second. Is there any additional discussion? Hearing none, Ms. Hackathorn, can you please call the roll?
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay. All right, Zibby, we're gonna move on down here to you to nuisance.
All right. Do you want me to present all three and vote at once, or do you want each one individual?
Individual.
All right, same folder. Okay, so 12664 Huntington Road. It's at this property, we have recently found out that the property owner is deceased. A daughter who we had worked with previously is also deceased, and so we've been in contact with a niece in attempts to get the solid waste on the front porch, as you can see, cleaned up. The niece no longer lives in this area and stated that due to her not being listed in the wills, she doesn't have any authority over the property. So tonight, we're just asking you to declare this property a public health nuisance.
It looks like somebody's living there. They had the water delivered.
But there is no one there. And we've received calls from a neighbor who goes and picks up mail. Between my conversation with the neighbor and the niece, a water line has broke, and there was water standing throughout the inside of the house at one point, where they ended up just shutting the water completely off to the property,
Okay,
but no one is there.
okay, could I have a motion to declare the property at 12664 Huntington Road, South Charleston, Ohio, a public health nuisance under authority of revised code 3707.01, and further ordering the owner, Peggy Marshall, or occupants, heirs, to abate the waste nuisance within 21 days. If such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under revised code 3707.02. Could I have a motion?
So move.
Second.
It's been moved in second. Is there any additional discussion?
So is Peggy Marshall the deceased? So who's in charge of it?
Right now, we don't.
Nobody? So if we do declare it as a nuisance, obviously, probably nothing's gonna happen in 21 days. So then what is the legal action mean? Does that mean that, like, the state or the city or whoever takes over the property, or?
They don't take over the property. They will, the court can say that you must do this, and there's options if they want to clean it up and put it on their taxes. Someone's going to own
A new
property.
owner, you mean?
Yeah.
Oh,
I mean,
okay.
either a bank's gonna take it, or it could end up at sheriff's sale. So when that happens, there is this order that says you gotta clean it up. And so whoever then takes over, if it's someone buys it, decides to tear it down, whatever, that would transfer to whoever's going to take custody of the property, so to speak.
Okay.
But we're not gonna let it sit there like that until they decide to sell it or find somebody that owns it, right? We're gonna,
Yeah, we are. What would the other option be?
oh, I thought we could go in there and clean it up and
We
then
don't
assess
go
it to their taxes.
We don't have funds for that. I mean, we don't
I
have
think we know
funds
how
set
to
aside
afford
for
it.
that at this point. I mean, we could, in the past, we've had little buckets of dollars to do this, but it's possible on the township, or where's this at?
Madison Township.
Madison Township.
Mm-hmm.
Sometimes we get the townships, they'll say, yeah, we'll do it and put it on their taxes, but
Okay. So we declare it a nuisance and just hang up a sign and walk away?
In this particular situation where there's no one physically living there, these are fairly rare. I mean, typically we have somebody living there, we are at orders, they're ordered to do it, they gotta do it, but
I'm
in these
just asking
situations,
because
no.
the other two have deceased people too.
One of the other ones does.
One of the other ones does.
Yeah.
Yeah.
Okay, so I'm just preparing myself for what's coming. And y'all too. Okay. Mhm. Okay. All right, so here it's been moved and second, and we declare this one a nuisance. Okay. So moving on to, oh, shoot.
This is been a long one.
All right. Ms. Hagedorn, can I please have a vote?
Dr. Moore,
Yes.
Dr. Robinette,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
Nuisance number 2
All right.
in the city.
2011 East Blue Road. There's a folder of pictures in this one. So this property caught fire. The house was full of solid waste when it caught fire. The house is no longer habitable, but now all the solid waste that was inside is exposed. We've attempted to work with the property owners on this property to get it cleaned up. They have not complied. So at this point, we're asking you to declare this property a public health nuisance.
This has become an attractive place
Hmm.
for
Yeah,
other
it's
folks
like a
to dump
newspaper.
stuff.
Oh.
Oh.
Mhm.
Okay.
Okay, so could I have a motion to declare the property at 2011 East Lee Road, Springfield, a public health nuisance under authority of revised code 3707.01, and further ordering the owner, Keith West, or occupants, heirs, to abate the solid waste nuisance within 21 days. And if such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under revised code 3707.02. Could I have a motion?
So moved.
Second.
It's been moved and second. Is there any additional discussion? Okay, so this one has a living person, right?
Yes.
Okay, and we just have to contact them. Okay. Any other questions?
How long ago did it burn?
April, I
April, it
believe.
was spring.
March,
Oh.
April.
Can I ask a question? I don't know that I'm allowed to. But I was just thinking like
You
something.
can.
Well, like, like say the Board of Health got a hold of me and like this was my house, I would have no idea what to do. Like, do they know, like, do we talking about options and stuff, or what are the options? Like, where would they even?
I
See what this
say
sounds-
strike another match.
Just let the fire department know.
What
and
there's
then
more
with it.
stuff to-
That's illegal.
I mean, Shane, there's nothing to say that they couldn't themselves rent a dumpster and
Gotcha.
a really good shovel or a bobcat. And
Well, and at one point, the property owner did say that, I just need some more time. My friend's got a excavator bobcat that they're trying to get working and I've been sick but it still looks like this.
So when's the last time we talked to them?
They've had 3 sets of
Mhm.
orders written.
Okay,
So by the time it gets to, I mean, really,
Yeah. I
mean,
they
we
have
sent
4
out the job
opportunities.
We
You're
sent the
right.
first
Yeah.
letter in the end of April, beginning of May. I believe that conversation was July, August. And we're just out there and it still looks like this, but with the grass a lot higher.
so because this one we know has an owner, would this be one of those that we could go in, clean it up, and it attached to their taxes? This is, I understand we don't have any.
I mean, so the ones that do have an owner, I mean, we have several, I mean, you've declared a lot of nuisances over
Yeah.
the years. We do one almost every meeting. And a lot of them end up in court. We have a couple pending right now in court and they can order them and then there can be, I mean, it can go as far as a bench warrant and I mean, it's just violating these laws are pretty serious. And so we let the judicial system work that
Okay.
piece of it, so.
Okay. Any additional comments? Can I take comments from the floor?
It's the board's decision.
Okay,
Sure, so that is a regular bike ride for me and has been over many, many years. And I've watched this home change hands several times. I know I'm very familiar with that particular piece of property. And over the last 5 years, probably maybe 6 years, when the current owners took it over, I saw a complete decline in the care of property. So I don't believe that that person who actually owns the property is totally capable of actually complying with anything you're gonna ask them to do. Because the property just went cars in the backyard, trash everywhere, yard not mowed. It was just, and like you said, you can give them it's gonna end up a bench warrant, I can tell you that right now, because this person obviously over years did not care for the property anyway. Incapable, got it out of song, back in, I think it was 2013, 2014, when it changed hands, maybe even a little after that. Got it for probably a song because where it is and the kind of house it is, maybe 8,000, maybe 10,000, maybe even 20 at the most, and we're able to afford the house, but we're not able to afford keeping it up. As many as we find out quite a bit. So I'm just putting that out there, which is sad. That's a great piece of property. I'd buy it and put a house on it, shoot.
Bobcat.
Hearing no additional discussion, Ms. Hackathorn, could you call the roll, please?
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette,
Yes.
Dr. Moore.
Yes. Okay, the motion is carried. Silly?
10472 Broad Cage Road. I don't have pictures of this one, I apologize. So this one, the property owner is also deceased. We've been in contact with a grandson who was out at the property one of the times we went out there, attempting to get the solid waste cleaned up. They haven't. This property is also though in delinquent tax foreclosure. And so right now it's going through the process of getting put on the tax sheriff sale. I don't know when that date's going to be. But so same as the last one, if we declared a public health nuisance, once it goes to sale, whoever buys it will
Have that responsibility?
have the responsibility to clean it up. So we're asking you to declare this property a public health nuisance.
Okay. Could I have a motion to declare the property at 10472 Broad Gauge Road, South Vienna, a public health nuisance under authority of Revised Code 3707.01, and further ordering the owner, Dorothy Doty, or occupants, heirs, to abate the solid waste nuisance within 21 days, and if such orders are neglected or disregarded, directing the health commissioner or his designee to pursue legal action under Revised Code 3707.02. Could I have a motion?
So moved.
Second.
It's been moved in second. Is there any additional questions or discussion? Hearing none, Ms. Hackathorn, could you please call the roll?
Ms. DeWitt,
Yes.
Dr. Robinette,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. So the motion has carried. Thank you very much. Policy review, professional development policy. Mr. Cook.
That's me. So what you have in front of you is an update to our professional development policy. This isn't new. And typically, if there are internal policies like this, they don't always come to the board. But the reason that I asked to have this on the agenda is because this puts some dollars in here, and you need to be custodians of those. And the policy itself, again, existed. We put some more clarity in here. It was kind of vague in some ways. But I think we did a good job of clarifying a few areas about what's eligible for reimbursement. But the biggest change there that you need to see is the reimbursement tiers. You see there's 3 tiers for professional development, tier 1, 2, and 3, with varying dollars of total reimbursement that for leadership, professional credentialed employees, and the non-credentialed employees. Again, not a new policy, but I wanted to put it in front of you because it actually has dollars and budgetary impacts. So be happy to entertain any questions.
Could I have a motion approving the updated professional development policy as submitted?
So moved.
Second.
I like the fact that it is also for any employee to have some professional development. I think that's very nice. That's the only comment and discussion I have. Any other discussion?
Well,
I was gonna say, that is new, Dr. Moore, that we didn't have that before.
I think that's very nice that our secretaries and everyone can know and get some professional development. It's very good.
And my question is, what would an example be of a non-credentialed training be?
Like for, like tier 3, a person, would be a clerk,
Customer
secretary.
service.
Like they would, engage in maybe a customer service training, I don't know, what other,
Microsoft.
Ways to
Training.
de-escalate.
some of the Microsoft training.
Okay, or
Okay.
de-escalate.
All right, thank you.
I think that's very nice. It's been moved in second. We've asked about discussion and no other discussion. Ms. Hackathorn?
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Dr. Robinette.
Okay. Staffing changes.
We have no staffing changes this month, no hires, no retires, resignations, so.
Nice. Thank you. And financial reports.
Okay. We have a new accounting software program, so these all may have a slightly different look, but it's all the same information that you're used to every month. As far as the vouchers go, that one's first. We've got it down to 5 pages. Normally it's more 8 to 10-ish. It's $184,000, which is mostly, and I don't mean this insincerely, but mostly smaller expenses. We've got a couple of big ones on there. One of the biggest is our tech advisors. We do all of our tech support. That's our quarterly invoice. But everything else is for the most part under $5,000. I'm happy to discuss any items that appear on there. If you have any questions about them.
Thank you. I like the look. Okay.
A little different, but I like it too.
Okay. Could I have a motion approving the payment of the bills from August the 1st through August the 31st, 2025?
So moved.
Second.
Okay, it's been moved in second. Is there any questions about any of the items or discussion? Hearing none, Ms. Hackathorn, could you please call the roll?
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Dr. Robinette.
Yes.
Transfers and advances?
No,
Moving on. Monthly fund report?
Every month I try and look through here and say, that kind of jumped out at me. That may jump out at one of you or anybody else who's examining this, and I'm referring out of the sheet of many colors. About 2/3 of the way down there, one that caught my eye this month, environmental health, account fund number 8240. If you look at last year versus this year, it looks like our income is down dramatically. It looks like our expense is also down dramatically. It's an important reminder to make sure you read the footnotes on these things. Last year's numbers include transfers. This year's numbers do not, and that's a big part of the changes. The other piece that happened before I got here, they did a 6-month time study on wages, and they were able to distribute those wages in a more accurate manner. And a result of that is that this 8240 has a reduced wage expense associated with it. So it looks like we've really cut a lot of payroll and potentially a lot of individuals as well, but that is not the case. We've done a better job of allocating the expense.
Thank you. We appreciate the cleanup.
Yeah.
Okay, no action there. Public health team reports. Sylvia, we'll start with you.
Thank you. All right, so fall's always a busy time in environmental health with completing school inspections. We've got a lot of festivals and so temporary food inspections happening. All of our septic installers are busy trying to get septic systems installed before winter comes. So we never know what winter may bring weather-wise. And any other work that we have going on, all the other stuff. So I just want to take a moment and say how appreciative I am of all the environmental health staff and the quality work that they do every day. And every year on September 26th, which is next week, is World Environmental Health Day. So Each day, our environmental health specialists address environmental health issues such as food, safety, security, water quality, spread of vector-borne diseases. Speaking of vector-borne diseases, tonight I'd just like to share a little information on a vector-borne disease that may be gaining some spotlight recently. It's called Chagas disease, which is caused by a parasite that's transmitted by the kissing bugs. I don't know if you guys have seen this on the news or heard about it, but the kissing bug gets the parasite from feeding on the blood of an animal or a person that's infected with the parasite. The parasite is carried in their guts and in their feces. It's not transmitted when they bite you, but if a person comes in contact with the feces of the kissing bug that's infected with the parasite, and then they touch their mouth, their eyes, scratch the bite, something like that, they can infect. That's how they would get infected. Some of the symptoms include like fever, tiredness, body aches, headaches, rashes, swollen eyelids, because it's called a kissing bug because they like your face. But once that parasite enters your body, if it doesn't get treated, the parasite can stay in your body and cause a chronic health issue, typically heart issues or problems. So things like, we don't typically see a lot of kissing bugs up here. However, with the warmer temperatures, their location is expanding. So typically it's more conducive to like Mexico, Central America area, but like I said, it is moving. So do things like seal your cracks and gaps in your houses, use screens in your doors and windows and make sure that they're intact, have proper hygiene, and just trying to reduce your exposure to the bugs. That's all I have tonight.
What's the treatment for that?
So if it's caught in the early stages, usually within a few weeks to a couple months of contracting it, there are medications. I don't know the names of them, but there are a couple that can treat. But a lot of people don't have symptoms, or you may
what are
not
the
have
symptoms?
symptoms.
Okay.
But it's things like fever, tiredness, body aches, headaches, rash, diarrhea. Some people get swollen eyelids. The bite is in the eyelid area.
Can you find it? Is it ugly?
Spotted in Warren
Oh, it is
Warren
ugly.
County.
Mhm. But it's not nice marking, so you'd be able to know what it is. Mhm.
The kissing bug.
So just something to
Be on the watch for.
be on the watch.
Watch them with all the stink bugs that are out. Okay. Any questions for Zibby? Thank you for sharing. Nursing and clinics, Ms. Cheyenne Taylor.
Yes, thank you. So we are just kind of in like the peak of back to school season and immunization. So it's very clinic heavy right now in the nursing division. We are, if you look, I'm actually kind of surprised by this, but this year we are still higher than our 3-year totals when it comes to immunizations. And then this week we were able to start giving out flu vaccines. So we're now kind of getting into that respiratory season as well. So take a look at those numbers, and if you have any questions, feel free. And then in communicable disease, I do want to give a shout out to that team. It has been a rough month doing case management and with that team. I feel like all of us have kind of been going into overdrive, trying to keep communicable disease and tuberculosis specifically case managed. But we are up to 4 cases right now in Clark County that we are managing. And it's just very labor intensive, very time management heavy, if that's how you would say that. But yeah, so just trying to get through that. We have 2 flu clinics scheduled for the next month. So we'll be going to Wittenberg, and then we'll be at the Health Expo on the 8th. So CCCHD will be out there giving vaccines. Yeah, just keep it going here.
Is that going to be downtown,
Yes, it's at the Hollenbeck Center.
Hollenbeck?
Yes.
Okay. That's centrally located.
Okay.
For flu vaccines?
Yes, yes,
Okay.
the flu vaccine, that is true. So, yeah, we will be at the Health Expo downtown. And honestly, the Health Expo is amazing. So it has just a vast majority of vendors and just community providers that come there. You get a ton of resources. It's all free. You can come in there. There are screenings there that are free as well. And then just a lot of resources there.
Don't forget who you're dealing with. You're dealing with people who are afraid of you.
Oh, yeah, fair enough. But we're out there.
I
You can.
know. Well, when we know that there's gonna be a screening, we let the people know.
Mhm.
And for the most part, their animosity towards any government entity is visceral
Mhm.
in their, I'm not gonna say hatred, but I'm gonna use that word hatred, because they know what will happen if you get them. So there's an definite fear that if you get them, then you will track them and they will no longer be free. So that's the thing that we fight against when we're dealing with the homeless, to convince them that nothing is going to happen to you, which is why it's important to go to them, not for them to come to you.
Mhm.
Because that is the standard operational modality for these folks. Is they are not going to come to you because they are scared of you. They know it could happen to them, should they be found. So we'll put that word out.
Mhm.
We'll get a few, and since I know, and Baron knows, and I think Sherry knows too, some of our hot spots that we can pass the word.
Yeah.
So when is that again?
You're gonna say, when is it?
It's on the 8th.
September 8th?
October the 8th.
Well, that gives me plenty of time. At the Hollenbeck Center?
From 4 to 6.
So you do understand that a majority, what was the time again?
4 to 6.
That a great number of our homeless frequent the library
Mhm.
because they can get free Wi-Fi. They can sit in a quiet place, not be disturbed, read the newspaper and so on and so forth, but they also sleep on the benches there, next to the old marketplace, and on the benches next to the bike path right there. So that would be a good opportunity on that particular date to get your little selves out there and say, look, why don't you come on over and take the screening with them. There's probably 20 or 30 roving around right in that area at that time frame because they're getting ready to find a place to go to sleep.
Sure.
Good.
Just saying that.
It could be a win-win.
Yep, absolutely.
Shirley,
And
Michelle?
thank-
Go.
Sorry,
No, no,
thank
no,
you for
go.
the Family and Friends
Oh, yeah.
Day on Monday. My husband and I came and got our flu shot, so
Nice.
thank you. That was very kind.
Yeah, you're
I
very
didn't have to make an appointment. So, thank you.
Yeah, you're welcome.
And it didn't even hurt.
No,
I was gonna say, mine didn't hurt either. It was
Yeah.
natural.
I'll tell the nurses that you guys said.
Yeah.
Shirley Childhood?
Yes, thank
Ms.
you.
Lambert.
Yes, thank you. I just wanted to highlight the Safe Sleep Initiative, which I'm gonna be talking about in a little bit, but our Cribs for Kids grant, we did dispense 33 this month, which is a little high for us because we participated in the BAM event, which Emily's gonna speak about. And this grant, the state allots us 290 pack and plays to give away each year, and we always run out this last month. And I let Chris and Gracie know that yesterday I learned, or a couple of days I learned that we may have an opportunity to increase ours so that we can make it through the whole year. So I'm going to look into that and see if we can make that happen. So
Wonderful.
that's all I have to say.
And I just wanted to make a comment. I'm so happy to see the vaccines are up.
Yeah.
Okay. Did you, or you want to say something? Okay. Women, Infant, and Children, Ms. Schaefer.
Thank you. As Lori mentioned, last month we had we hosted our Breastfeeding Awareness Month event, and in the report we shared some snapshots of the day. It was a resource fair layout, so you can kind of see that in the pictures. In addition to our team's breastfeeding, education, and promotion materials, 7 other community programs were available for moms to meet with and learn about services for their families. Guests walked away with program information, promotion items, breastfeeding support materials, diapers, and they had an opportunity to enter for a chance to win one of 3 raffle items. But overall, we had 61 attendees and 34 of those were moms. We were pretty pleased with this because the last 2 years, we did not have a special event for our breastfeeding celebrations. And then our nutrition and breastfeeding supervisor, Isabel Heising, did a wonderful job with the planning and organizing the event. So many thanks go to her and the WIC team and our vendors in attendance. It was a really great event. So hopefully you can see that from the pictures. And then the other thing I wanted to talk about is, if you noticed on the report, our contract dietitian, Ashley, was very busy last month with her highest number of days in the hospital and completion of 93 appointments. So she reports that participants remain excited about our presence being in the hospital, and it's clear that our time there is making an impact, a meaningful impact. So I am also happy to report that Ashley has her contract has been extended to continue with us another year, allowing those on-site hospital visits to continue.
Wonderful. Right.
Very good.
That's all I have.
Health planning.
Yes, hello, thank you. I just have a couple of quick things to mention before we get to our special presentation from Lori. Over the past month, we have actually received notice of award for 2 of our outstanding health planning grants. One was for the Adolescent Health Resiliency Grant. So that is training adults that interact with youth on how to be trauma informed and be a trusting adult for children. So we were excited about that. And then our Creating Healthy Communities notification of award came in as well. So for the year, we have gotten all of our notifications of awards for the health planning grants, which we accept the lead as we talked about. But we were, we were cautiously optimistic with all the changes, but now that we have all of those, we can set on for another year. So we're excited about that. The other thing I wanted to highlight, I know I talked about it leading up to it, but Overdose Awareness Day happens every year on August 31st. But this year we had a 2-day event here in Clark County on August 28th and 29th. So there's a couple pictures in your packet. Jacob Clark is our overdose prevention coordinator, and he organized everything and did a great job. There's some statistics throughout the day. It was a great day. So the Thursday, it did end up raining towards the end, so that put a damper on it. But Friday, it was beautiful, and we had really good attendance. As you can see, was able to distribute a lot of Narcan, fentanyl test strips. And one thing that I think may not seem like a lot when you look at it, but we're very proud of it. We did end up helping to connect one person and get them entered into treatment at the event. So yes, so one, you might think, oh, that's not a lot, but anytime anyone is willing and you're able to connect them, that is a win. So we had over 25 vendors across the 2 days, a lot of treatment providers, recovery support specialists, things like that. So we were really excited about that success. And then the other thing that I wanted to point out is the little boxes that you have in front of you. This is something new that we provided this year. It's actually a keychain that 1 dose of Narcan fits into. So the keychains, we passed them out. They didn't come with the Narcan. You could get that separately through Project Dawn. But it's just a way that is easily accessible. You can put it on, I keep it on my backpack, you can put it on a purse, whatever you need to. It's a little discreet, but easily accessible. So individuals that were getting the Narcan through our Project Dawn partner with McKinley Hall, also had an opportunity to pick up these keychains, and they were very excited about it. So we wanted to offer those all to you. There is a dose of Narcan in those for you. But it's just, another way that we're trying to make, harm reduction as accessible as possible to everyone and easily, these boxes are great, but, if this is in your backpack, it gets smashed and all that. So keeps it intact and ready to use. So,
Thank you.
thank you.
Thank you.
Because Gracie's given those to you. They're not just on display.
Yeah, they're not just on display.
Take a walk out with them.
Thank you.
Don't try to squeeze it. But I can do it.
I tell you, it's a live dose.
Good thing you weren't practicing how to use it.
Okay. Special report on safe sleep, Ms. Lambert.
Yes, ma'am.
Okay.
At CEUs, if you
Thanks
need them.
for allowing me the time to get your is it CEUs that you have to? Okay, that you're gonna finish up for the year, so I'm happy to talk to you about safe sleep. Just to start out, just to say that we'll be talking about prevention, which is great, but we'll also be talking about infant death. And we know that is going to be difficult for all of us, so just thinking about that. But to intro a little bit, sleep-related deaths in babies is all too common. Sudden infant death, or the acronym is SUID, that you're probably familiar with, is among the leading cause of death in babies under 1 in the U.S. Sudden infant deaths include SIDS, which you've heard of, and accidental suffocation or strangulation in a sleep environment. So if I look this way, can you still hear me? Okay.
Yes.
Okay, good. And the AAP recommends parent follows the ABCs of safe sleep to minimize the risk. So it is a problem close to home. You're probably aware that the infant mortality rate is an indicator of maternal and baby health in the community, and it's a good predictor of how well the community is doing. In Ohio, you can see that we're in the dark blue, and unfortunately, the dark blue means we have the highest rates in the nation. So several of the states that are dark blue, including Ohio. And then if you remember, infant mortality rate is how many babies we lose under 1 per 1,000 live births. That's how they come up with the rate. And if you look down into community rates, then like each county, Clark kind of falls in the middle. The ones that have the lowest rates, there's about 10 that have rates that are lower than 4, 2.6 being the lowest, and you might guess which county it is. So this county historically has the highest per capita income and the best health outcomes. I bet Chris and Gracie probably know. Does anybody know? It's Delaware County. Yeah. So they have some of the lowest infant mortality rates. And then the higher ones you could imagine. There are like 5 or 6 of them that have over 10 in the Appalachian. There's Toledo, Lucas County, and then the Appalachian County. So Clark kind of falls in the middle there. And then these are our snapshot from a couple of years of data. Our causes of death, the prematurity is always the highest. That's true across the nation and Ohio and Clark County. It kind of follows suit. Usually right below that is congenital anomalies, but I see here we have unknown and undetermined. And then we can see Anna Jean made this pie chart to help explain. So it said 22% of infant deaths have circumstances related to the sleeping environment. And what that represents there is, I think, 7 deaths in that time period. And then so far this year, I think we've had 3. Does that sound about right from your child fertility review? I think we've had 3 so far this year.
3 or 4.
Okay, because I'm maybe 4 now. And then according to the Ohio chapter of AAP, the infants most at risk for unsafe sleep or sleep-related deaths are those less than 4 months of age, preterm infants, those that have secondhand smoke exposure, those that bed share with somebody who uses illicit alcohol or drugs, overheating of an infant, bed sharing with a child or others or pets, or placed on soft surface. Now let's see. I'm gonna look at my notes on this one. The pathophysiology of sudden infant death is complex and not easily understood. So those that do the leading research in this area have come up with this triple risk model to help us kind of explain it. So the critical development period, that just speaks to the fact that like I mentioned in the last slide, that the risk is most 4 months and less. Just like the risk of child abuse and neglect of the whole childhood, the risk of abuse and neglect is the highest a year and younger, So in this particular instance, it's 4 months and less. That's the critical developmental period. And then a vulnerable infant, they're speaking about dysfunction or immature cardiorespiratory or immature arousal systems. So that's a contributor. And exogenous, yes. Exogenous stressors, those are the external stressors like the sleep environment. Was the baby overbundled and overheated? Were they in a flat surface? Or were they in a prone position? You probably saw the press release that went out last week about babies. We lost 2 babies that were in the prone position. And they were advising medical providers not to encourage that prone position. And I'll kind of show you why here in a second. According to the Child Fatality Review data, most sleep-related deaths were found to be preventable, in fact, 78%. And then the most deaths are in the adult bed, 52%. And then this was kind of interesting too. The most prevalent risk factors were the overall unsafe sleep environment. So you can see white and black families, 79% and 81% unsafe sleep environment. The bedding was an issue. And then more white families, it looked like, than black families did not keep their babies on their back. And we'll send this out to you in case you want to look at it a little more closely.
Are we allowed to ask questions
Yeah.
at any time?
Oh, sure.
So the
Yes.
previous one
Yes.
with the swaddling, because I know, like I have a grandson
Yeah.
that's at 6 weeks old now.
Yeah.
And they tell the parents to swaddle
Oh,
them.
yes. And swaddling is perfectly safe as long as the baby has not started to move out of that. Because
Okay.
then the bedding becomes an issue. That's the
Okay.
first application.
Okay.
So, yeah. Yeah, swaddling is recommended and perfectly safe. And the overheating is also interesting because, we want to put blankets and want them to be comfortable, but the science tells us from the research that if you're comfortable, your baby's comfortable.
Mhm.
So they don't need the extra. And in fact, the last recommendations even recommended that in the hospitals, they don't wear the caps, but a lot of still do because they haven't really got the regulation of their temperature down yet. And then they remove the cap. So I don't know how long hospitals will still do the caps, but the last recommendations recommended that they disappear. So we'll see, unless the baby is premature. Okay, so this was internal factors. They talk about most of the deaths were related to infections, and that shows the data there. And this is all in the link in the report that I have at the end. So unsafe sleep causes of death may be accidental suffocation or strangulation, positional asphyxia, overlay, or undetermined. Because there's no single cause of death, unsafe sleep deaths are an approximation based on variables present, which is kind of confusing for a lot of people. So SIDS is a lot of times we just hear SIDS, but it's actually the medical diagnosis. It only represents like 5% of sudden or infant deaths. So this was interesting too, the trends in the SUID rates, that's the acronym for this. So it wasn't until 1992 that the research told us that babies need to be sleeping on their backs. So that recommendation came out in 92, so we started seeing a drop. But then 1994, some of you might remember Tipper Gore, okay, she had a safe sleep campaign. There was a campaign that was national, and that was a significant drop. So we went from, in 94, we went from 10,000 deaths per year in our nation down to 3,500. So just making that change made a significant thing. What's troubling though, so we see that, but our rates kind of flattened out, they've flattened out. We haven't been really making the traction that we need to make, and they've slightly gone up actually. That's concerning. So what can we do? So those are the kind of things that we're up against. But these are the recommendations from the Academy. Back to sleep for every sleep. Use a firm, flat, safety-approved sleep space. Breastfeeding is protective, so encouraging breastfeeding. Putting the message out, share your room, just not your bed, getting that message out. And it's recommended that you room share for at least 6 months. Place your baby in a bare crib, which is hard, but that's the safest. A pacifier is also a protective factor, so encouraging pacifier use. Avoid smoking, overheating, and swaddling, but safely. Keeping up with medical visits and vaccines, because that is also shown to be protective. Research baby products before buying, the Consumer Protection Agency has extremely small staff there's lots of things out there that aren't safe that you see, and just trying to get the word out and trying to watch that you buy things that have the approval. And then, of course, if we're asking people to have their babies on their back most of the time, we need to encourage that tummy time so we don't lose that developmental importance of that developmental piece, and then spreading the message about this. Then I wonder if this will work. How would I see if
Is it
it'll play?
video?
Yeah, it's a short video just to explain.
Oh, I'm sorry.
I think
Up
if you
here?
just click on that Cribs for Kids animation, that right there, and you'll have to flip through the ad probably.
It says click to watch.
Yeah. Okay. Let's see, it was moving already, so you'll have to.
When sleeping on their backs,
Thank you.
babies are less likely to choke when they spit up. This is because of the shape of your baby's throat, which is shown in this diagram. When babies spit up while on their back, most of the liquid comes up from the stomach and out of the mouth. Any spit up that stays in the throat goes back to the lowest point, which is the food pipe. The baby then swallows the liquid back down the food pipe and into the stomach. If any liquid gets near the air pipe, the baby will cough it up to protect itself from getting liquid into the lungs. When babies spit up while laying on their bellies, most of the liquid still comes up from the stomach and out of the mouth. Any spit up that stays in the throat still goes to the lowest point. But now, with the baby laying face down, the lowest point in the throat is the breathing tube that leads to the lungs. If the baby tries to breathe in before this fluid is cleared away, the liquid can go into their lungs, which is called aspiration. This can be very dangerous for the baby, and why it is so important that babies sleep on their backs so they don't choke on their spit up and then breathe it into their lungs.
Okay, so that's really simple, and it's only a minute long, but it seems like when we show families that, and we can tell them all day long, but when we kind of show the diagram, like, oh, that makes a lot of sense. And also, a lot of people don't realize that babies haven't really developed the reflex to breathe out of their mouth until they're a few months old. So really their natural way is to breathe through their nose. Of course, the mouth would open if there's congestion, but they're just wonderfully, beautifully made so they can nurse and breathe at the same time. And then just knowing that, encouraging back sleep has cut the sleep-related deaths in half just by going from prone to back sleep. And then I put in some, we do lots of different kind of educations depending on the setting that we're in. But this is from the Cribs for Kids website. It's fantastic. I know the hospital's trying to work on some accreditation around Cribs for Kids, so that'll be great. And there's a quiz in there, and usually it depends on the group that I'm in, but we might show pictures. Some places we don't have internet access, so we don't actually play the game, but we just say, is this safe or non-safe? And they answer, and then we explain what their good things are in there, and then what things that you saw are unsafe. Same with this one. And of course, that's not safe. It has all the blankets, we're inclined. And when we explain why it's not safe. This one is safe, actually, okay, because we have an alert caregiver that's holding the infant. This is adorable, but potentially not safe because the brothers, they're gonna skedaddle, the baby can be left alone. There's bedding, it's too soft. This one is not safe. It's safe, of course, for the car ride, but then once you get home, it's recommended, and it's hard to do because baby's asleep, you don't want to, but it's highly recommended then that you take baby out and you put them in their own environment. And it is interesting though, if you think about car seats, it wasn't until I think 1986 that car seat laws finally passed in all 50 states. So you think now, people don't even think about not using a car seat, it's ingrained in our society, but really we lose more kids less than 1 to unsafe sleep than we do for all children in auto accidents 15 and under. But yet, it hasn't really caught on as well. And then, of course, this used to be the thing, but now it's not. It's recommended that twins have their own environment, just because of the data. And although this is adorable, it's also has a lot of things that make it unsafe. Babies on her belly.
I thought you were supposed to have some tummy time.
Well, you are. And in fact, that's kind of recommended if you're not asleep like that dad was.
Oh, he's sleeping.
Yeah, he's asleep. Is that you can do tummy time while you're laying down and you're holding baby, like almost as soon as you get home from the hospital. So it's recommended pretty quick. So, and then these are examples of what a safe sleep environment looks like. Then Cribs for Kids eligibility, it's 32 weeks pregnant or have an infant less than a year. They all have to be low income as in defined as 200% of FPL. And I mentioned we currently collaborate with Springfield Regional. We have the cribs delivered there. And then we try to catch people prenatally so we can do the education ahead and they can be prepared. But if that doesn't happen, which unfortunately often doesn't happen, then they are able to do the education in the hospital instead of home. And then we're also kind of working on, they kind of have a little setup right when you get off the elevator of a safe sleep environment, but it needs some help. So I'm working on trying to get like a little bit better display there. So that we can talk to families about safe sleep. They can see that education right there. This is what's in the survival kit. The sleep stacking is recommended. And then this is just kind of the closing. Since the first Back to Sleep campaign, we've dropped 50%. SIDS is not preventable, but SUIs most often are. We need to get that message out. Back to sleep for every sleep. Babies need to breathe. I think that a lot of families just don't understand that it's asphyxiation or suffocation that we're losing babies. Black infants are highly overrepresented amongst infant death reviews, 36 and 54%. Again, encouraging room share, not bed sharing, and that we're all important ambassadors to safe sleep. Just talking to people about what their plans are. This is a resource page that I always send out to anybody. It's got the link to the HIO Child Fatality Review that I spoke of. And it also has, that's a great link that says Safe Sleep Order Form. So any agencies that serve families that could benefit from this information, just click on that link and it goes to Ohio Department of Health and they can have the stuff sent right to their agency. So I try to share that as much as I can. And lastly, I thought this was a good reminder. At the beginning of the year, the governor did a press conference, I think it was in the spring, and he said the newest data told us that our infant mortality rate, I think the first slide, it was 7.1. We've actually made some progress and we're down to 6.5. And he said since he took office, this was the most appreciable difference that we've had. So that is pretty great. And they shared that it's like 4 full kindergarten classrooms will start school because of our efforts in safe sleep. So I thought that was a pretty good way to visualize that. So we have 4 more classrooms and kiddos because we were able to get that infant mortality rate down to 6.5.
Nice.
So more work to do, but it's encouraging. Any questions at all?
Thank you, that was very nice.
Thank you, you're very welcome.
Lori, that video of the airway
Airway.
was the most impactful thing that I've seen. And I just thank you for sharing
Well,
this.
certainly, this is hard to explain, but it's easy to see. Yeah, thank you.
Thank you very much. Health Commissioner comments. Mr. Cook.
Just to round out a few things here on what's been going on in the legislature, I'll just mention 2 or 3 bills and what's been going on. One thing I think I failed to mention when we talked about House Bill 96, which was the budget bill, talked about the things that got vetoed, things like that. One thing that came out of it that was good that I think I failed to mention is that there was a request for $3.9 million to fund funding for the State Department of Health laboratory. All right, so that's a lot of times first line of defense where we're talking about avian influenza, things like that, things that are at the cusp. We actually just had I'll just mention the goose. This week that was there was a goose in Clark County that was acting erratically. It was put down. It was tested. There was some suspicion about avian influenza. We actually found out it was West Nile virus that killed this goose. And so I underscore this because our lab, I will tell you, our state lab is underfunded. The ask was 3.9 million, which was level funding. But at the very end, the conference committee said, you know what's on the horizon is going to be significant. We see what's going on with potential of avian influenza or some other things that are brewing. And they actually dropped another 5 million into it. So it's funded at almost $9 million for this year, which is the most significant increase to our public health lab capacity at the state level, not us, since 2013. So in over 10 years, more than 10 years, it has been since we've been funded at this level at the state lab. And it's good foresight for, I think, unfortunately, what are things to come. We always have to be prepared for the next public health threat. And I think the state lab getting some extra funding in the general funds is significant. I'll mention Senate Bill 220, which has to do with medical services, specifically community paramedicine. If you've paid attention, Springfield Regional has started a community paramedicine program. It's very impactful. The Senate Bill 220 would say that community paramedicine programs have to be reimbursed by Medicaid and managed Medicaid programs at the same rate as any other medical provider. Unfortunately, the way this bill is written, it is specific to ambulatory and paramedicine. And so any paramedicine program that is run through anything other than a fire EMS isn't covered. And ours is run through a hospital. And I've already had a couple of conversations with the representatives that are sponsoring this bill saying, please include more than just fire and EMS where that community paramedicine is being born and run out of. It needs to include hospitals because our hospital needs that reimbursement as well. So in that Senate Bill 220. Senate Bill 230 is interesting. It authorizes pharmacists to screen, test, and provide treatment for certain respiratory illnesses. And so this is something that's making its way through. And for me, I'm looking at this going, okay, well, as a provider, I'm gonna look at a provider. I don't know if this is something that you would be concerned about. Nurse pracs, doctors saying, hey, why should pharmacists be able to prescribe medications based on a screening or a test that they did? For me, in my public health role and it's access and capacity, right?
And they're really
So
smart.
if you look at this, so it does list several health conditions in this Senate bill, again, Senate Bill 230, saying that pharmacists, obviously with some proper training, can not only administer screenings and tests like at a minute clinic or something like that, but they could also treat and prescribe for things like influenza, group A strep, COVID, RSV, and other respiratory conditions are outlined. So again, we're a HPSA health professional shortage area where we don't have enough capacity docs. I look at this as a positive thing if our pharmacists are willing to take that on. And it doesn't mandate to them to do it, but it says that we could through this bill. So this is in committee right now. We'll see where that goes. And then finally, I think I'll end with, I know I got this one over here too. ACEs, Adverse Childhood Experiences. In the last General Assembly, there was a bill that would create an ACE study committee. That bill died. There is some talk about it in this new General Assembly, the 136th General Assembly, saying that we want to reboot this and have a study group to look at adverse childhood experiences and how they affect health long term. So I will tell you, the Association of Health Commissioners is very supportive of this. Watching it carefully, we do strongly support the creation of this study group to look at ACEs and where we can impact in our kids' lives early on that have very much lasting effects on their health. And finally, House Bill 420, 421, and 422 are what is called the Taxpayers' Freedom Trilogy. These are written very, in my humble opinion, strangely. It is literally written Taxpayers' Freedom Trilogy, Act 1, Discontinuing the Continuum, Act 2, Arresting Inside Millage, Act 3, The Triumph of the Taxpayer. I think it's weird language for state legislation, but this is the target of property taxes and inside millage, things like that. I think we're coming up on a perfect storm where property taxes, well, y'all are residents, right? You get something fun in the mail the last couple of weeks, it made you go, uh-oh, got to budget differently, right, for your property taxes. There's that. There is, this trilogy of bills. There's the movement to push back on, to eliminate property taxes altogether. There are proposals for our safety voting in jail here. All of these things are swirling into a perfect storm where people are going to slide one way or another on a spectrum of how they feel about these different proposals, not only at the state, but at the local level. I don't know where we're going to end up, but all of this has a play for us because we do have a small levy, and it could potentially be impacted by this. If property taxes go away and there's no plan, what happens to our continuing levy? And so a lot of questions, not a lot of answers yet, but at the state level, they're working through what they believe to be a good work group looking at this, again, taxpayers' freedom trilogy. So I just wanted to bring your attention to those three different House bills if you'd like to look them up.
What's a paramedical?
I'm sorry, what?
What's a paramedical? You said-
Paramedicine?
Paramedicine, community paramedicine. So that was I think it was maybe 2 years ago,
It's in
the
Urbana.
hospital's gala,
It
yeah.
started in Urbana, and then we had the gala to support that for
Yes,
Springfield.
it's another word for it. It is different than this, but I'm gonna use this word street medicine. So it takes medicine to people. So we have a community paramedicine person that can actually do delivery of medical services to people. I will tell you that we believe in this. I support it. Zibby and our community paramedicine tried to attempt to make a visit to someone very much in need in our community this week. It didn't go well because someone's got to accept it, but we tried. And the person that's doing the community medicine here, just getting her start, she is absolutely fantastic. I think it's a good thing for our community. We believe in it. Like I said, we partnered with them we saw a person in need. We do that every day of the week. We see need out in the community, and we get a hold of our partners. If we're not, doing that ourselves, we find the person to pull them alongside of us, the agency, the partnership, and we try to help people as much as we can. We tried this, didn't quite, like I said, come out how we hoped, but that's what community paramedicine is. It's street medicine. Yeah.
Thank you.
So that, from my updates, legislative updates, that's it. Any other questions?
Okay. No need for executive session. Is there any additional business? So our next meeting will be on October 16th, 2025 at 6 p.m. Current location. And so we are going to adjourn. Can I get a motion to adjourn the September 2025 meeting, please?
Second.
Okay, it's been moved and second. Any discussion about it?
No.
Ms. Hackett?
Voice votes, fine.
Voice, okay. Could I get an aye? Okay, any opposed? Okay, this meeting's been adjourned. Thank you very much.